So the last part of the talk is really going to be on staging, because this is really important. Once you've identified that there's a lesion there, next you try to characterize what the lesion is with the imaging studies. The next thing is to show where the lesion is and the extent of the lesion in order to gauge if it help in treatment. So remember that staging is based on two things, histology and also tumor extent. Depending on the grade or the compartment where the lesion is. So tumor extent is really a description of the compartment, whether it's intra or extra compartmental, or whether that's metastatic, they extend outside into a different parts of the body. The grade is really the histology. What the pathologist showed the tumor is a low grade, high grade, and that is going to affect the combination of two of these will tell you the stage of the lesion. This is the staging system. This is only for mesenchymal tumors and not for Ewing's lymphoma or leukemia. So in this case, this is an extracompartmental lesion. You can see a tumor here in the distal femur. Here you can see the abnormal high signal subtissue component that's oozing out of the bone here. You see it better here in the axial image. This is a common feature for round cell tumors such as lymphomas, which can sort of permeate the cortex here and have a soft tissue component that comes out. The other thing is, how does this lesion relate to other important structures? In this case, we have a lesion that's around the bone here. You can see that's in the surface of the bone that has a humongous soft tissue component. In this case, it's come up and it's actually involved the femoral vessels here. There's some encasement or involvement of the femoral vessels as this tumor has come up in that area. That's very important because during surgery, they need to be careful to see if there's actually tumor that's been involved by the neurovascular bundle. In this case, on pre and post imaging, you can see that there's areas that you hear that have more enhancement. The rest of it is very necrotic, so you want to target the area that has more enhancement for the biopsy. Is there joint involvement? Because whether or not there's joint involvement will determine whether or not you may have to do an allograft or do a hardware to resect the remainder of the bone. In this case, you can see that here's the tumor here. And tumor actually extended into the anterior cruciate ligament. Clearly, there's joint involvement within this lesion. Here it is here. You can see the post-contrast, the lesion extended into the anterior cruciate ligament. This is a person with a chondroblastic osteosarcoma.